First, the definition of the transversus thoracic plane block. The transversus thoracic plane block, formerly known as parasternal plane block, is a new regional anesthesia technique described since 2015. It provides analgesia of the anterior cutaneous branches of the T2 to T6 intercostal nerves to the medial anterior chest wall. Analgesia is provided via a single injection of local anesthesia between the internal intercostal muscle and the transversus thoracic muscle, located in the third and fourth, or fourth and fifth intercostal space at the sternum. Let's have a closer look at the anatomy to better understand the transverse thoracic plane block, which we will call TTP block during this presentation. The sternum's body derives its innervation from the anterior cutaneous branches of intercostal nerves 2 to 6, which are displayed here with a red circle, and the sympathetic plexus around the internal thoracic artery. The nerves lie between the internal intercostal muscle, which is labeled capital G on this figure, and the transversus thoracic muscle within the transversus thoracic plane, labeled as capital H. In addition, a collateral branch also aids in supply and runs along the upper border of the rib. Here again, much closer, you can see the transverse thoracic muscle with underneath the internal thoracic artery and vein, and also the perivascular sympathetic plexus around the internal thoracic artery. Also visible on the slide from another perspective. This is a view on the inside of the sternum with the attachments of the transversus thoracic muscle. In addition, we can well distinguish the internal intercostal muscles. Transversus thoracic muscle actions results in a weak depression of the ribs. The muscle is innervated by the 2nd to the 6th intercostal nerves. Let's have a view on the anatomy on a cross-section view about 2 cm lateral from the sternum, and we will recognize the following structures: the pectoralis major muscle, internal intercostal muscle, the transversus thoracic plane, the transversus thoracic muscle, with underneath the pleura. As a mnemonic, we can remember the successful muscle layers of the pectoralis major muscle, internal intercostal muscle, and the transversus thoracic muscle as PIT, like pit bull. Here on this ultrasound image, we will recognize the same structures as in the previous cartoon. The transversus thoracic plane is located between the internal intercostal muscle and the transversus thoracic muscle with underneath the pleura. In ultrasound imaging, costal cartilage is displaced as a black shadow. On this longitudinal ultrasound real image, one can see the anatomy of the transversus thoracic plane block before injection. The transversus thoracic muscle is identified as a hypoechoic band that overlies the pleura. And this is the ultrasound image during injection of local anesthesia into the transversus thoracic plane, with a spread of local anesthesia between the internal intercostal muscle and the transversus thoracic muscle. As it can be seen here, again, more simplified on this cartoon from Satoru Fuji and co-workers. We will now have a view on the anatomy of the parasternal region on a transverse cross-section of the sternum. First the skin, below is the sternum, then the pectoral major muscle, with underneath the internal intercostal muscle, further below the transversus thoracic plane and the transversus thoracic muscle surrounding the internal thoracic vessels. Then further posterior starts the mediastinum with the pericardium and the heart, and the neighboring thoracic cavities including the pleura and the lungs. Anterior cutaneous branches of the intercostal nerve pass inside the transversus thoracic plane, and then continue through the internal intercostal and pectoral muscle further into the skin with a lateral branch of intercostal nerve, branching off a medial branch of the intercostal nerve. In summary, on this slide, the sternal cross-section anatomy of the transversus thoracic muscle in relation to its surrounding structures. On this sternal cross-section, the needle target for the TTP block is directed into the transversus thoracic plane, where local anesthetics is injected, which is displayed here as a blue solution. Also shown on the contralateral side of the sternum.